and welcome. We have a very special guest today in our studio. He is Professor Bidyut Kumar Das, Professor of Immunology and Rheumatology at SCB Medical College, Cuttack. He is the person who has established the Department of Immunology and Rheumatology at SCB Medical College, which serves more than 50,000 patients a year. Hello sir, and welcome sir to our show. First of all, we would like to know, you have come here to attend the national conference being organized by Biotechnology Department. So what is your impression about the university?
Yeah, thank you very much. I must thank the department for inviting me. It was a very interesting subject which they have chosen, emerging trends. This is the flavor of the year, other than artificial intelligence, which people talk about in other subjects. So this is my first visit to the university campus, but I've come to MKCG Medical College as for giving talks and attending different conferences. Looks very beautiful campus, looks clean, but I have not gone around. I don't know how it is.
We would like to know about your journey and why you mainly focus on clinical immunology and rheumatology.
First of all, I have told my young students today that as a doctor, I selected a path which is not taken by other people. Most doctors do not get time to do research. So what they do, basically we see patients and teach students in the medical college. I decided to do research, which is very rare in the medical community, in government setups. I'm not talking about AIMS or PGI Chandigarh. They are very established department where research is mandatory to get promotion. Here research is not mandatory. But I decided to be a researcher, influenced by some members in my family who are very great scientists. So I did not involve myself in private practice and I took up research. I was professor of medicine. But I realized that there is some lacuna that we are missing. There are thousands and thousands of patients suffering from autoimmune disease which are not being treated properly because we do not know that subject well. I did a PhD in immunology and then I went to SGPGI Lucknow where I went because of a fellowship. And there I realized that there are so many patients which we are not diagnosing, missing because we are not taught. I came back 1996 and then started to build this unit from within Department of Medicine, and it took me 20 years to set it up because of lots of difficulties I faced in course. And I did this because first that there was a deficiency in treatment of patients. 90% of my patients are women. Autoimmune disease affects primarily women in their productive age to 15 to 35, 40. And they were not being treated properly. And besides the long duration it took me, immunology as a subject is not understood by many people in this country. Out of 360 odd government medical colleges, this is only the 6th medical college in the country, government setup, which has a department of immunology. Only the 6th. And I am not talking about the central institutes like AIMS, PGI, Chandigarh. Imagine if you have only 10 institutions and you have millions and millions of patients, where do you think they are going? How are they getting treated? What is the end result? So this has been very, very satisfying for me. So I deviated from general medicine, which I completed, and I took up this subject and I created the department.
You have started tele-rheumatology service in Odisha. How you think patients who are in remote area of Odisha get better facility by this?
We have a telemedicine center at SCB Medical College, one of the best in the country. It is connected to all the 30 districts. Nobody used to use it. Maybe use it once in a while for training purpose or maybe at a conference. I realized a lot of my patients need lifelong treatment. They are not curable. They are treatable. So if you are not curable, you have to come for follow-up. And I realized these patients told me that they are dropping out because they can't come. One visit from Malkangiri or Kodandi, Koraput takes them 10,000 rupees. So then I say, once I've seen you, please go and attend telemedicine at your center. And that is how I started in 2015. And it has been so satisfying. I've already seen 28,000 consultations in the last 10 years. And it has really established a point of treatment especially of patients who are far off, remote areas, who cannot come, who are poor or underprivileged, they cannot come. These are the patients, and especially women in rural areas don't like to come to a hospital. So they are better, they say, okay, we are well off by telemedicine. Yeah, I mean, we get lots of feedback and we get a lot of importance for that. COVID time, we saw 6,000 patients in WhatsApp because there they cannot come to the center. So at home we used to talk to them, and WhatsApp was a wonderful. So I think this is a wonderful method by which, and I teach students through that, and I teach doctors in the periphery through that. This is a method by which in India, I think it will be a transformative. There are many platforms, but they are paid. This is private, completely free. You can actually transform health services across the country if you use telemedicine services.
You have always worked directly with the patient. What drives you, sir, to work so dedicatedly for your patients?
Love for my patients have come because I promised never to do private practice or take money from a patient. That was my first. And that's how I could spend all my time. And the satisfaction that I get when I cure a patient, when the patient comes back and says thank you, it cannot compare with any money that I would have got. Serving the poor and unprivileged was a drive to me. It was a passion for me. Therefore, I'm so different from majority, most of the doctors. They see me as a different person. So that drives me. That doing good to people who cannot otherwise get treated is the biggest driving force in my life.
You have received Biju Patnaik Award for Scientific Excellence. So how this pushed you to work more and be more dedicated?
I told you science research is not done by medical doctors in our country except in a few places, and therefore in a government setup to get that award was a big boost because it took invitations invitations from all Odia scientists working across the country. That means I was in different fields, not just biology, it was in different fields. And to win from among them, working in a state medical setup, without much funds, without much manpower, was one of the most amazing turning points of my life. And since I have been doing research from 1988 onwards, and this is thrown an example to my younger students and colleagues that it really pays in the end if you're committed and passionate. I give them 3 P's. I said I work on 3 P's. You're passionate about your work. 2 is your patience. 3 is perseverance. Any subject, you carry these 3 P, you'll be successful in there.
Department of Biotechnology is organizing 2-day national conference on emerging trend in biology and biotechnology, and on this occasion you have received Lifetime Achievement Award by the department, and we would like to hear something from you.
I was telling them my lifetime is not over. I still have many more years to go. Maybe I could have got it after 10 years. So this was a huge honor for me. And biology, biotechnology, they are 2 subjects that are intimately related to medical science. One thing I learned is collaboration. You collaborate with basic scientists. They are basic scientists mostly. And you get good results. No research can be done independently now. Single-handedly, I have a lot of collaborators. I have collaborators here. Dr. Aditya Panda, Department of Biotechnology, has been working with me from 2010. And we have published lots and lots of papers. And then I collaborate with the Institute of Life Science. And therefore, being a doctor, seeing patients, and then doing research has been very, very satisfying in my life. And I think I have told the students 3 P's: select a subject, be passionate about it, persevere, don't get, oh, I'm not happening, don't quit, and then have patience. It comes with it. So I've been honored, perhaps with God's grace, that I still have some energy left within me to do something more.
Thank you so much, sir, for sharing your expertise and experience with us, for sharing the valuable time with us. Thank you so much.
Thank you. Thank you very much.